So I just came back recently from a week up in Canada visiting family and friends. And it was a very rich time. I really enjoyed it. And I saw a lot of old people. Yes, older than me, like in their 80s and 90s. And on my way back, I came across this article in the New York Times that I thought was so, it grips your heart, really. And it made me feel even better about what I spent my time doing in Canada, visiting people who are quite elderly. They're not getting out much anymore, and 2 of them are in the hospital now with very serious things going on. So this article is called How Social Isolation is Killing Us. It's a very compelling article, and I think this time of year especially, loneliness is a very big topic for people. And you would think, well, this is going to inform us in a lot of ways of who this is striking, and actually then we're going to talk about what we can do about this. Because, it's very lovely for us to every day in the morning and evening recite the 4 measurables. May all sentient beings have happiness in its causes, and sort of just get blurred out and numbed out about who all of these sentient beings are, when it might be our neighbors who just need, a visit. So, anyway, this is how the story runs. My patient and I both knew he was dying. Not the long kind of dying that stretches on for months or years. He would die today, maybe tomorrow, and if not tomorrow, the next day. Was there someone I should call? Someone he wanted to see? Not a one, he told me. No immediate family, no close friends. He had a niece down south, maybe, but they hadn't spoken in years. For me, the sadness of his death was surpassed only by the sadness of his solitude. I wondered whether his isolation was a driving force of his premature death, not just an unhappy circumstance. Every day I see variations at both the beginning and end of life. A young man abandoned by friends as he struggles with opioid addiction, an older woman getting by on tea and toast, living in filth, no longer able to clean her cluttered apartment. In these moments, it seems the only thing worse than suffering a serious illness is suffering it alone. Social isolation is a growing epidemic, one that's increasingly recognized as having dire physical, mental, and emotional consequences. Since the 1980s, the percentage of American adults who say they're lonely has doubled from 20 to 40%. About 1/3 of Americans older than 65 now live alone, and half of those over 85 do. People in poorer health, especially those with mood disorders like anxiety and depression, are more likely to feel lonely. This next sentence is interesting. Those without a college education are the least likely to have someone they can talk to about important personal matters. A wave of new research suggests social separation is bad for us. Individuals with less social connection have disrupted sleep patterns, altered immune systems, more inflammation, and higher levels of stress hormones. One recent study found that isolation increases the risk of heart disease by 29% and by stroke by 32%. Another analysis that pooled data from 70 studies and 3.4 million people found that socially isolated individuals had a 30% higher risk of dying in the next 7 years, and that this effect was largest in middle age. I wouldn't have guessed that. Loneliness can accelerate cognitive decline in older adults, and isolated individuals are twice as likely to die prematurely as those with more robust social interactions. These effects start early. This is the part that I found very surprising, but actually not really. Socially isolated children have a significantly poorer health 20 years later, even after controlling other factors. All told, loneliness is as important a risk factor for early death as obesity and smoking. The evidence on social isolation is clear. What to do about it is less so. So far this is, not really surprising, but I think it's very important that we take our mind to this. Loneliness is an especially tricky problem because accepting and declaring our loneliness carries profound stigma. Admitting we're lonely can feel as if we're admitting that we've failed in life's most fundamental domains, those of belonging, love, attachment. It attacks our basic instincts to save face and makes it hard to ask for help. So I saw this in the people I visited last week. They're elderly. They don't get out much. And even some of them, this one couple, they're 94, they're still refusing help. And it was clear when my sister and I showed up, they were delighted to have some company, and yet they're refusing help. They're 94. It's hard, when you've been independent all your life, it's hard to admit that we need help, and harder yet to admit that we're lonely. I see this most acutely during the holidays. This is the important part. When I care for hospitalized patients, some are connected to IV poles in barren rooms devoid of family or friends. Their aloneness amplified by cheerful Christmas movies playing on wall-mounted televisions. And hospitalized or not, many people report feeling lonelier or more depressed and less satisfied with life during the holiday season. Well, of course, when you're seeing television and everything, everyone's surrounded by beautiful family and friends and there's gifts everywhere. It's just not reality. New research suggests that loneliness is not necessarily the result of poor social skills or lack of social support, but can be caused in part by unusual sensitivity to social cues. Lonely people are more likely to perceive ambiguous social cues negatively, and then when they perceive this negative cueing, they enter a self-preservation mindset, worsening the problem. In this way, loneliness can be contagious. When one person becomes lonely, he withdraws or she withdraws from his or her social circle and causes others to do the same. I think I'm going to skip forward here. The loneliness of older adults has different roots, often resulting from family members moving away and close friends passing away. As one senior put it, "Your world dies before you do." Now, this next sentence is very ambiguous, and this is what I want to argue with. So, it says, ideally, experts say, neighborhoods and communities would keep an eye out for such older people and take steps to reduce social isolation, ensuring they have easy access to transportation through discounted bus passes or special transport services, and this can help maintain social connections. Great idea, but who is doing this? Neighbors and communities. It's so vague. What it takes is either a family member, and I know this from experience, or a next-door neighbor who's very attentive. But neighborhoods and communities? I don't know, in the United States and Canada, everyone sort of keeps to themselves, So this is where we have to get involved. So now we're going to get to some things that are upbeat in this story. Religious older people should be encouraged to continue regular attendance at services, and of course they'll benefit from a sense of spirituality and community, as well as the watchful eye of fellow churchgoers. Those capable of caring for an animal might enjoy the companionship of a pet, and loved ones living far away from a parent or grandparent could ask a neighbor to check in periodically. So obviously, we have to get involved. Families have to get involved. Neighbors have to get involved. Religious groups have to get involved. Now, here's a very cool thing. There's more structured programs that are starting up. For example, Dr. Paul Tang of the Palo Alto Medical Foundation started a program called Link Ages. So in the description of this talk today, I'll put that link in. And you can Google this, because if this isn't going on in your community, you might want to start it. It's a cross-generational service exchange inspired by the idea that everyone has something to offer. The program works by allowing members to post online something they want to help with: guitar lessons, a Scrabble partner, a ride to the doctor's office. Others can then volunteer their time and skills to fill these needs and bank hours for when they need something themselves. In America, Dr. Tang says, you almost need an excuse for knocking on a neighbor's door, and we want to break down these barriers. For example, a college student might see a post from an older man who needs help gardening. She helps him plant a row of flowers and banks 2 hours in the process. A few months later, when she wants to cook a Malaysian meal for her boyfriend, a retired chef comes by to give her cooking lessons. So you don't need a playmate every day, Dr. Tang says, but knowing you're valued and a contributing member of society is incredibly reaffirming. This program now has hundreds of members in California and has plans to expand to other areas. Then the author goes back to say this: we in the medical community have to ask ourselves, are we controlling blood pressure or improving health and well-being? And Dr. Tang says, I think you have to do the latter to do the former. A great paradox of our hyper-connected digital age is that we seem to be drifting apart. Increasingly, however, research confirms our deepest intuition. Human connection lies at the heart of human well-being. It's up to all of us, doctors, patients, neighbors, friends, families, communities, religious communities, groups, to maintain bonds when they're fading and create ones where they haven't existed. So in reading that, I think it's just something that isn't new to us. But, as people, I think even now, if we're living in a neighborhood and your neighbors aren't old yet, or you're not old yet, whatever that means, it's probably really good to start now in making connections with people. And so the one good thing about these friends of mine who are 94 is that their next door neighbor has been a friend for probably 5 decades. She's a great cook. She keeps her eye on them. And so she brings them meals all the time, even though they refuse it. So this has been a long time connection, this built up caring. And even if we're living at a monastery, the other day we walked down the road to meet 2 of our new neighbors, and we brought them some treats and wished them a happy holiday season. But I think it's very hard for older people to admit that they're lonely. I mean, you only have to look in someone's eyes and you see it right away. And then hospitals right now are filled with people. Not everyone has time to get to their families. There's extended care facilities. There's old folks' homes. When my dad was, eventually we had to put him in extended care because we couldn't handle his level of incapacity. My sister was there all the time, and she said that she saw all kinds of people in the dining room and in the areas around this place, sitting, staring, looking out the window, nobody coming to see them. Nobody. So, my sister would do what she could, but, if you are thinking, what's my life about right now, and you don't have a spiritual practice, and you're interested in making it worthwhile, well, first of all, you can consider starting a spiritual practice. But the second thing is reaching out to people and lead. Because, there's endless opportunities. When I was in the hospital last week visiting a family member, she didn't know we were coming. And so she just lit up like a light bulb when she saw us. But the ward was the hospital was filled to overflowing. There are people in the hallways, in hospital beds, nobody around, people just lying there. So I think loneliness is a big topic. I think it's something we can do for others very easily. It doesn't take much on our part. And I think it's something that we should really get on right now if you're wanting to know, what shall I do in 2017?